Karnataka. The expert committee headed by K.S. Ravendranath, Director of Sri Jayadeva Institute of Cardiovascular Sciences and Research, that was entrusted with the task of studying the reported rise in sudden heart attack deaths in Hassan district, is now all set to submit its report to the State Home Minister. Now, amid mounting public anxiety over the rising trend of sudden cardiovascular events post-COVID-19 pandemic, the Karnataka government had in February this year set up an expert committee headed by Dr. Ravendranath to evaluate the temporal and potential causal link with prior SARS-CoV-2 infection and COVID-19 vaccination. Now, the committee has not found any association between premature cardiovascular disease and a prior history of COVID-19 infection or COVID vaccination in the case. Now, with regard to the reported deaths that have been coming from Hassan district, the same committee comprising senior cardiologists, public health experts, epidemiologists and also officials from Hassan district was given about 10 days to investigate and submit a report. And now the deadline has reached and we'll be getting the report that could answer the questions between why Hassan has been witnessing a series of heart attack related deaths. Now I'm being joined by my colleague Gautam Shankar. He's been closely tracking the story on the ground. Gautam, what can we expect from this report that will be submitted today?
Absolutely, a very crucial report that will be submitted to the Karnataka government. And like you rightly pointed out, there's been a lot of concern about the series of heart attacks that has been witnessed, particularly in Hassan district. Now, the official number is that 23 individuals have died mysteriously of cardiovascular related diseases. And this has prompted this report as well. Now, what we understand is this 10-member committee has basically looked at these unusual spikes in heart attack cases, and the team has compiled the data through a structured questionnaire, and they have spoken to numerous people across the district with a series of 50 targeted questions. And what we also understand is that this report basically is based on a three-model investigation framework. And the first point here to note is that the committee has looked into post-mortem examination reports. Basically, they have analyzed cases where autopsies were conducted, and they have also looked at hospital diagnostic reports where data from patients who visited hospitals and underwent ECG and blood tests, and also they have looked into the cases where patients were on the way, and they compiled all of these information and looked at the histories of victims who died before reaching the hospital as well. So this three-pronged analysis is expected to provide a sort of broader understanding of the alarming rise in heart attack heart attack related deaths in the district. And now the countdown is on for this technical committee to finally submit its report as well. Now, if we just have to give you a sneak peek of what's in the report itself, and now according to early insights, the primary cause has been identified in many cases as patient negligence. The report that has been formed by the committee basically highlights that several victims reportedly ignored early symptoms of heart attacks, and they delayed hospital admission, leading to fatal outcomes. And this report also highlights unhealthy lifestyle factors contributing to deaths as well. The primary reasons that they have found is that there is poor dietary habits, excessive smoking and alcohol consumption, and high cholesterol levels. But all of this will be presented in an official format when it's given to the Karnataka government, and we will also see a set of guidelines that come into place in the state of Karnataka as well here.
Right, Gautam. Clearly crucial findings coming to light from this report that could help people take precautionary steps on the ground. But, what is the situation on the ground right now? There were reports of panic spreading among residents and hospitals being packed with worried patients, after a series of such incidents came to light in Hassan.
Absolutely, because this incident from Hassan, where we've seen multiple deaths due to heart attacks, has triggered a sort of panic, not just in Hassan, but across the state of Karnataka. Especially, there is a prominent hospital here just for cardiovascular related incidents, Jayadeva Hospital, where we've been witnessing a massive rise in numbers, and people have been queuing up, even though they do not have any sort of reason to worry about them having sort of heart condition, and the OPDs are absolutely filled with people who want to get this preliminary checkups done. They want to ensure their heart condition is fine, And that is the reason we are seeing an overload in several of the hospitals in Bangalore and across Karnataka, where people are actually worried about heart attack related fatalities in this region. And this examinations and the report that will be submitted today should go a long way in basically easing concerns among the people as well. Because what it basically hints at right now, from the sneak peek that we've had, is that unhealthy lifestyle factors is the major contributing factor. As long as people can control this part, and which is absolutely under their control, then we could see these fatal outcomes of heart attacks and cardiovascular related incidents coming down significantly in the state of Karnataka and Hassan here.
Clearly, now as you mentioned that it is, the negligence on the part of people and also lifestyle factors that are responsible for the series of heart attack related deaths that you're witnessing in Hassan and not COVID vaccine. So then do you think these findings will finally put a stop to that theory that links these heart attack related deaths to COVID-19 vaccination?
Absolutely, because like you rightly pointed out, there was a sort of bitter war that also erupted between Chief Minister Siddaramaiah and the Chief of Biocon, Kiran Mazumdar as well, where Siddaramaiah had basically hinted that we should look at a possible causal link between COVID-19 related vaccines and them having a possible reason behind these heart attacks that we're witnessing. But the report has already gone on to say that there is no real link between COVID-19 vaccination, and that theory has basically been ruled out. But also keep in mind that the people are extremely anxious as well, and there's been a lot of politics.